51. The abducens nerve controls lateral movement of the eye. True or false? Answer: true. Rationale: the abducens nerve, cranial nerve 6, innervates the lateral rectus muscle, enabling lateral eye movement, a key component of cranial nerve assessments in neurological exams. 52. The central nervous system is responsible for voluntary muscle contractions. True or false? Answer: true. Rationale: the central nervous system, particularly the motor cortex and corticospinal tract, initiates voluntary muscle contractions, critical for understanding motor deficits in neurological conditions. 53. The trochlear nerve is responsible for pupil constriction. True or false? Answer: false. Rationale: the trochlear nerve, cranial nerve 4, controls the superior oblique muscle for eye movement, while pupil constriction is mediated by the oculomotor nerve, important for neurological testing. 54. The somatic nervous system regulates heart rate. True or false? Answer: false. Rationale: the somatic nervous system controls voluntary movements, while the autonomic nervous system regulates involuntary functions like heart rate, a key distinction in neurological physiology. 55. The parietal lobe processes tactile sensations like touch and pressure. True or false? Answer: true. Rationale: the parietal lobe, particularly the somatosensory cortex, interprets tactile sensations, essential for assessing sensory deficits in neurological examinations. 56. Parkinson's disease is caused by an overproduction of dopamine. True or false? Answer: false. Rationale: Parkinson's disease results from dopamine deficiency in the substantia nigra, leading to motor symptoms like tremors, a critical concept for neurological management. 57. The hypoglossal nerve controls tongue movements. True or false? Answer: true. Rationale: the hypoglossal nerve, cranial nerve 12, innervates tongue muscles, facilitating speech and swallowing, a key focus in neurological assessments for cranial nerve function. 58. The resting membrane potential of a neuron is positive. True or false? Answer: false. Rationale: the resting membrane potential of a neuron is negative, approximately -70 MV, due to ion distribution, a fundamental principle for understanding nerve impulse generation. 59. The vestibular nerve is responsible for hearing. True or false? Answer: false. Rationale: the vestibular nerve, part of cranial nerve 8, regulates balance, while the cochlear nerve handles hearing, critical for distinguishing neurological sensory impairments. 60. The prefrontal cortex is involved in decision-making and planning. True or false? Answer: true. Rationale: the prefrontal cortex, part of the frontal lobe, governs executive functions like decision-making and planning, key to assessing cognitive function in neurological disorders. 61. A lumbar puncture is typically performed at the C1, C2 vertebral level. True or false? Answer: false. Rationale: a lumbar puncture is performed at the L3, L4 or L4, L5 level, below the spinal cord's end, to safely collect cerebrospinal fluid, a critical procedure in neurological diagnostics. 62. The sympathetic nervous system constricts blood vessels during stress. True or false? Answer: true. Rationale: the sympathetic nervous system triggers vasoconstriction via norepinephrine release during stress, increasing blood pressure, a key response in neurological regulation. 63. The pia mater is the outermost layer of the meninges. True or false? Answer: false. Rationale: the pia mater is the innermost meningeal layer, adhering closely to the brain and spinal cord, a distinction important for understanding neurological infections. 64. The substantia nigra produces serotonin for mood regulation. True or false? Answer: false. Rationale: the substantia nigra produces dopamine for motor control, while serotonin is synthesized in the raphe nuclei, critical for distinguishing neurological neurotransmitter roles. 65. The spinothalamic tract transmits pain and temperature sensations. True or false? Answer: true. Rationale: the The spinothalamic tract carries pain and temperature signals from the spinal cord to the thalamus, essential for assessing sensory function in neurological exams. 66. Alzheimer's disease is characterized by excessive myelin production. True or false? Answer: false. Rationale: Alzheimer's disease involves amyloid plaques and tau tangles, leading to neuronal loss, not excessive myelin, a key pathological feature in neurological cognitive disorders. 67. The accessory nerve controls shoulder shrugging movements. True or false? Answer: true. Rationale: the accessory nerve, cranial nerve 11, innervates the sternocleidomastoid and trapezius muscles, enabling shoulder shrugging, critical for cranial nerve assessments. 68. The choroid plexus absorbs cerebrospinal fluid in the brain. True or false? Answer: false. Rationale: the choroid plexus produces cerebrospinal fluid, which is absorbed by arachnoid villi, a key process for maintaining intracranial pressure in neurological health. 69. The dorsal root ganglia contain motor neuron cell bodies. True or false? Answer: false. Rationale: dorsal root ganglia house sensory neuron cell bodies, while motor neuron cell bodies reside in the spinal cord's ventral horn, important for neurological reflex testing. 70. The Broca's area is responsible for speech comprehension. True or false? Answer: false. Rationale: Broca's area in the frontal lobe governs speech production, while Wernicke's area in the temporal lobe handles comprehension, key for assessing neurological language deficits. 71. The vagus nerve stimulates gastric acid secretion. True or false? Answer: true. Rationale: the vagus nerve, via its parasympathetic fibers, stimulates gastric acid secretion in the stomach, a critical autonomic function in neurological digestive regulation. 72. A transient ischemic attack causes permanent neurological damage. True or false? Answer: false. Rationale: a transient ischemic attack causes temporary neurological symptoms without permanent damage, unlike a stroke, a key distinction for neurological emergency management. 73. The corticobulbar tract controls voluntary facial movements. True or false? Answer: true. Rationale: the corticobulbar tract innervates cranial nerve nuclei for voluntary facial movements, critical for assessing facial weakness in neurological conditions like Bell's palsy. 74. The optic disc is the area of sharpest vision in the retina. True or false? Answer: false. Rationale: the optic disc, where the optic nerve exits, is a blind spot. The fovea centralis is the area of sharpest vision, important for neurological visual assessments. 75. The reticular activating system regulates consciousness and alertness. True or false? Answer: true. Rationale: the reticular activating system in the brainstem modulates consciousness and alertness, a critical function for assessing neurological status in comatose patients. 76. Schwann cells produce myelin in the central nervous system. True or false? Answer: false. Rationale: Schwann cells myelinate peripheral nervous system axons, while oligodendrocytes myelinate central nervous system axons, key for understanding neurological repair mechanisms. 77. The Wernicke's area is located in the frontal lobe. True or false? Answer: false. Rationale: Wernicke's area, responsible for language comprehension, is in the temporal lobe, not the frontal lobe, a critical distinction for neurological language assessments. 78. The sympathetic nervous system slows digestion during stress. True or false? Answer: true. Rationale: the sympathetic nervous system inhibits digestion during stress to prioritize energy for fight or flight responses, a key autonomic function in neurological regulation. 79. The ventral horn of the spinal cord contains sensory neurons. True or false? Answer: false. Rationale: the ventral horn contains motor neuron cell bodies, while the dorsal horn processes sensory input, a key anatomical feature for neurological reflex arcs. 80. The cerebellum is responsible for higher cognitive functions like memory. True or false? Answer: false. Rationale: The cerebellum coordinates balance and motor skills, while higher cognitive functions like memory are handled by the hippocampus and cortex, key for neurological localization. 81. The oculomotor nerve controls pupil dilation. True or false? Answer: false. Rationale: the oculomotor nerve, cranial nerve 3, controls pupil constriction, while pupil dilation is mediated by the sympathetic nervous system, critical for neurological exams. 82. The pyramidal cells in the motor cortex initiate voluntary movements. True or false? Answer: true. Rationale: pyramidal cells in the motor cortex send signals via the corticospinal tract to initiate voluntary movements, a key mechanism in neurological motor control. 83. The anterior cerebral artery supplies the occipital lobe. True or false? Answer: false. Rationale: the anterior cerebral artery supplies the medial frontal and parietal lobes, while the occipital lobe is supplied by the posterior cerebral artery, key for stroke localization. 84. The glossopharyngeal nerve controls the gag reflex. True or false? Answer: true. Rationale: the glossopharyngeal nerve, cranial nerve 9, provides sensory input for the gag reflex, critical for assessing swallowing safety in neurological patients. 85. The sodium-potassium pump is inactive during an action potential. True or false? Answer: false. Rationale: the sodium-potassium pump restores ion gradients after an action potential, maintaining the resting potential, a key process in neurological signal transmission. 86. The midbrain regulates visual and auditory reflexes. True or false? Answer: true. Rationale: the midbrain, containing the superior and inferior colliculi, coordinates visual and auditory reflexes, essential for neurological sensory assessments. 87. The arachnoid motor produces cerebrospinal fluid. True or false? Answer: false. Rationale: the arachnoid motor is a meningeal layer, while cerebrospinal fluid is produced by the choroid plexus, a distinction critical for neurological diagnostic procedures. 88. The basal ganglia inhibit unwanted muscle movements. True or false? Answer: true. Rationale: the basal ganglia modulate motor activity by inhibiting unwanted movements, a function disrupted in neurological disorders like Huntington's disease. 89. The optic chiasm is where all visual fibers cross to the opposite side. True or false? Answer: false. Rationale: the optic chiasm is where nasal retinal fibers cross, not all fibers, allowing binocular vision, a key concept for assessing visual field defects in neurology. 90. The parasympathetic nervous system increases heart rate. True or false? Answer: false. Rationale: the parasympathetic nervous system decreases heart rate via the vagus nerve, promoting rest, a critical autonomic function in neurological regulation. 91. The dorsal column-medial lemniscus pathway transmits vibration and proprioception. True or false? Answer: true. Rationale: the dorsal column-medial lemniscus pathway carries vibration, proprioception, and fine touch to the cortex, essential for sensory neurological assessments. 92. Myasthenia gravis is caused by excessive acetylcholine release. True or false? Answer: false. Rationale: myasthenia gravis results from autoantibodies blocking acetylcholine receptors, reducing neuromuscular transmission, a key neurological autoimmune condition. 93. The pons relays signals between the cerebellum and cortex. True or false? Answer: true. Rationale: the pons contains fiber tracts that connect the cerebellum and cortex, facilitating motor coordination, critical for neurological movement assessments. 94. The frontal lobe processes olfactory information. True or false? Answer: false. Rationale: the frontal lobe handles executive functions, while olfactory processing occurs in the temporal lobe and olfactory bulb, key for neurological sensory exams. 95. The cauda equina contains spinal nerve roots below the conus medullaris. True or false? Answer: true. Rationale: the cauda equina consists of lumbar and sacral nerve roots below the conus medullaris, critical for assessing lower limb neurological function. 96. The thalamus is responsible for motor coordination. True or false? Answer: false. Rationale: the thalamus relays sensory and motor signals, while the cerebellum handles motor coordination, a distinction important for neurological localization. 97. The facial nerve controls eyelid closure. True or false? Answer: true. Rationale: the facial nerve, cranial nerve 7, innervates the orbicularis oculi muscle for eyelid closure, critical for assessing neurological facial function. 98. The internal capsule contains motor and sensory fiber tracts. True or false? Answer: true. Rationale: the internal capsule carries corticospinal, corticobulbar, and sensory tracts, a key structure for understanding neurological deficits in stroke patients. 99. The sympathetic nervous system promotes bronchodilation. True or false? Answer: true. Rationale: the sympathetic nervous system triggers bronchodilation via beta-2 receptors, aiding respiration during stress, a key autonomic response in neurological care. 100. The primary auditory cortex is located in the occipital lobe. True or false? Answer: false. Rationale: the primary auditory cortex is in the temporal lobe, while the occipital lobe processes vision, a critical distinction for neurological sensory localization.